So today I'm joined by an expert panel of leaders in mental health and suicide prevention. They're going to share their views on the current state of mental health and suicide prevention in UK universities and colleges. And they're going to discuss what the next level of mental health in education looks like. We will be discussing the topic of suicide today. However, we will not be discussing any means or any methods. Today's discussion is around about 60 minutes with a Q&A towards the end of the session. So my name is Steve Carr, and I'm going to be your moderator for today. As an accredited mental health, workplace wellbeing and suicide first aid trainer, I bring a blend of corporate and personal experience to this role. My career initially flourished in the corporate middle management until I experienced a mental health breakdown. This challenge led to an inspiring transformation. Now, I embarked on walking the entire length of Britain in recovery, advocating for mental health and homelessness, a journey that was instrumental to my recovery. Can I just check that everybody can still hear me? Had somebody say that they can't hear. Okay, if we can just check that out, that would be wonderful. Thank you. Subsequently, many years later, I embraced the opportunity to work as an IPS team leader and specialist within the mental health recovery and psychosis, early intervention psychosis teams in the Baines NHS Trust. This experience, whilst enriching, also highlights the importance of a healthy work environment. And so I created a now award-winning mental health training business. And I'm excited and delighted to be here today for this meaningful discussion with you all. I'm joined by a wonderfully diverse group of leading experts in the field of mental health and suicide prevention, each bringing a wealth of knowledge to today's topic. First, we have Fiona Aldred. Fiona is the Chief Executive of the National Centre for Suicide Prevention, Education and Training, CIC. Fiona is an inspirational leader, consultant, coach, suicide prevention tutor, and experienced chief executive who is passionate about making a difference. Fiona has 39 years of experience in the third sector and has undertaken innovative work and can claim credit for successfully rolling out suicide prevention work in Wales. Positive Choice, Mental Health First Aid Wales in partnership with Mind, developing a stop smoking model for people with mental health concerns. Rolled out through the Stop Smoking Wales, this service achieved a 60% success rate verified by Public Health Wales. Next, we have Professor Anne Luce, Professor of Journalism and Health Communication, Bournemouth University, who have also deployed Ripple. Dr. Anne Luce is a Professor of Journalism and Health Communication with nearly 10 years of journalism covering health and science, business reporting covering government and politics, and editorial writing experience in the United States. Anne has spent the last 15 years researching and writing about suicide and mental illness. One of her most notable pieces of journalism was investigating suicide rates in Florida, which eventually garnered support for the creation of the Office of Suicide Prevention and Drug Control in the state of Florida. Anne works closely with the National Health Service here in the United Kingdom and the World Health Organization on creating guidelines, media campaigns, and training for journalists around the world on ethical and responsible reporting of suicide. Anne has consulted with governments in Wales and Norway and to reduce suicide rates. Next, we have Steve Phillip. Steve is the founder of the Jordan Legacy and co-founder of Baton of Hope. Steve Phillip was a successful leadership and sales coach and corporate speaker, heading towards semi-retirement when in December 2019, he received a call that would change his world forever. His 34-year-old son, Jordan, took his own life. Within 12 months of this life-changing experience, Steve established the Jordan Legacy to provide hope for people who are feeling suicidal by engaging all who share his ambition and moving towards a zero suicide society. With a following of more than 56,000 people on LinkedIn, Steve delivers impactful and inspirational talks. Like his keynote presentation, The S Word, using his own lived experience and insight to help others spot the signs that somebody might be struggling with their mental health and how to provide support to those who are feeling suicidal. And finally, we have Sam Smith, Education Advocate and Development Manager at Ripple. Past experiences in mental health in the school settings. Sam brings extensive experience in safeguarding and a strong commitment to improving mental health provisions across diverse settings. His professional background as a frontline police officer compelled him to establish a campaign for reshaping, mental health standards within law enforcement. Later, he specialized in children's safeguarding to shield vulnerable youth from exploitation. As an education advocate and development manager for Ripple, Sam collaborates with education providers to help them protect students and staff from harmful online content. He is passionate about advocate for transformative changes in mental health and awareness and suicide prevention within this sector. Good morning, speakers.
Good morning.
Morning.
Good morning.
Good morning.
There has been a noticeable increase in students reporting mental health conditions in higher education. I would like to start today's discussion with asking you your thoughts on the following statistics from a recent report by the Mental Health United Kingdom. This report is the largest health survey ever conducted on United Kingdom university students and reveals concerning trends. The report was written this year. Almost half, 42% of United Kingdom university students surveyed have experienced serious personal, emotional, behavioural or mental health problems requiring professional help. 78% of students with a mental health diagnosis have concealed their symptoms due to stigma and discrimination. Despite 82% of students being aware of university support services, only 13% have accessed them. However, 2/3, 63%, have said they would use online access to mental health services and professionals if available, raising the question about the effectiveness of current support methods. In the United Kingdom, particularly in the academic year of 2020, indicate that there was 64 suicides in higher education students, and harmful internet use was found in 26% of deaths in under 20s and 13% of deaths in 20 to 24-year-olds. And this was from statistics from the Samaritans. So Steve, I would like to come to you first, if I may. What are your thoughts on these statistics, especially around suicide?
Well, I mean, clearly they're concerning, aren't they, when you read out the numbers as you do. We've been having concerns with loss of students to suicide at university level for some years now. On average, we lose 200 students every single year. And I think there's been a lot of concern about the protective measures that are in place at universities for those students. In fact, there's been some very high profile campaigns from the likes of the Learn Network, a group of bereaved parents who came together to campaign very successfully to some degree with a petition that garnered more than 128,000 signatures for the statutory duty of care at universities. So these figures are worrying and alarming, but we've had a concern and an issue that I don't think has been addressed by all the 200 universities by any stretch of the imagination in the country.
Thank you, Steve. And Anne, as a specialist in this area, you're working in universities. What's your thoughts here?
I think it's quite complex. I think there's a number of factors that we need to be looking at. We've got issues in the community feeding into university environment. So, for example, you've got students who are moving to a new town, say for a new city, to go and attend university, so leaving home. For students who have already been under the care of community mental health teams in their local area, what you find is when they move to a new location, they oftentimes don't meet the thresholds for support and care once they get to the university. And I know this is an issue that colleagues around the country are facing. So then universities are left with, well, here's a young person, 18 years old, who's received loads of support perhaps for many years. They move to this new area. Our local NHS community mental health teams are saying, no, you don't meet a threshold for care. So then they're left vulnerable. And that risk is then left with universities. And it ends up being, it exhibits itself in many different ways, from academics who are not trained in mental health support, and don't believe that they should be doing that job. And I kind of agree, being an academic in some ways. We can get into that conversation a little bit later, I'm sure, but there's that side of it. There's the disclosure side of it. It doesn't surprise me that students don't disclose their symptoms due to stigma. None of the information that you shared there, none of those statistics really surprise me, to be honest, which is quite sad. To actually be able to sit here and say, yeah, I expect that. We have something there that we need to address.
And I think you're right there with a lot of these statistics. None of these are shocking, are they? But it is just sad to know that this is still happening in today through lack of education, funding, training. Thank you, Anne. Sam, may I bring you in at this point? What's your thoughts here?
Yeah, I find that really interesting, and I think the key word is stigma. I think stigma is still massive, a cultural thing in the UK certainly, but when we've got to consider a lot of students are coming from overseas, we have a huge amount of foreign interest in our universities, and many of them will come from cultures where actually mental health is nowhere near discussed or considered. And this is why we've got to be very creative as education providers on finding ways to reach those people, because it's often those people, unfortunately, the ones we lose. And I also think it shows that as much as we can talk about mental health and be supportive and sort of advocate for it, as a society, we've got to make sure that's genuine and believed and understood. In many cases, sometimes it feels that it's just a movement or a feeling that we're saying it and we're ticking boxes rather than actually meaning the support is there. And we also got to make sure that what we're offering is actually capable of working for a diverse amount of students, not just saying, oh, we're here to do something, and then actually they experience quite the opposite. We've got to make sure that our words are meant and meaningful. And I think this shows that a lot of people are more comfortable being online is because quite often actually they feel more safe there. They feel that sense of privacy. In many ways, that can be dangerous in itself, because obviously we know the online community can be take you completely astray and down dark and dangerous routes. So we need to be careful with that.
Wonderful. Yeah, thanks very much, Sam. It's about being more inclusive, isn't it? And changing what we're offering to be more inclusive for people from diverse backgrounds. Thank you. Fiona, may I bring you in at this point? Do you have any thoughts on these statistics?
Yeah, I think I echo everything that everybody else says, but I also think I'd add to that fear. I think there's a massive fear in society. Suicide isn't a subject that we've been brought up with to talk about, so we don't have the language, we don't have the understanding as to how to approach this. A number of things that we do in life, everyday things we've learned from our family, our friends, close people to us. Actually, all we've learned about suicide is that we don't talk about it, we're frightened of it, it's not very pleasant, and it's a closed subject. And I think that is something that as a society we need to address. It doesn't matter whether that's in colleges, universities, or generally in society. We need to take away the fear, and we need to look at the subject head on, and we need to make some significant changes in the way we approach this. And I guess, thinking about working in a population, we don't just have one cinema, one theatre, a pub, there isn't just one of everything that we can go to. There's many things, because we're a diverse community. There's many things that meet our needs. So I think there's not one solution to this. I think there's many solutions. And I think, a number of us here today, we're looking to be involved in those solutions. You know, talking about students who come from somewhere else, they come to a university and they've not got this wraparound support. You know, we need to work collaboratively, because that support should be coming from their home services. They shouldn't be landing in university with, you know, a lifelong support network around them and then be given to a college or a university, handed over and said, well, sorry, now you're an adult, that's it, it's all stopped, you're on your own, because we're really setting people up to fail. So I think there needs to be more collaboration. I think we need to look at this subject head on, take the fear away from it and remove the stigma. And that way, then we can look at the possible solutions and start working collaboratively to move ourselves forwards.
Thank you, Fiona. Some really important words there, which is working collaboratively. I remember many years ago doing a little piece of work when I came back from Walking Britain and saying exactly the same thing. And this was almost 8 years ago, that we need to be working more collaboratively if we're to address the problem. These statistics highlight the growing concern for mental health among UK university students and college students, and there needs to be an effective solution for intervention strategies. However, it is important to note that these figures could reflect increased willingness to report rather than a direct increase in mental health issues. These statistics underscore the growing concerns regarding mental health among students in Great Britain, and there is a need for effective support systems and destigmatisation efforts in educational institutions. Fiona, I'm going to stay with you just for a moment now. Just going back to something that Anne was saying about the primary risk factors and barriers and the misconceptions that prevent the students from talking about their mental health. What's your thoughts around this? What are some of the misconceptions and barriers that some of the students face?
Okay, well, I've worked in suicide prevention in a sort of dedicated way since 2005. So I've spoken to a number of colleges, universities, schools, and there's some common threads here that I hear. So if we go back and we just think 1 in 20 people think about suicide, and we're talking about thoughts here, not behaviour. So take some of the fear out. This is somebody who's having thoughts at this stage. And they go and they approach somebody within the university that they've built up a trust with, and they say, I'm having these thoughts. And that person will respond in a number of different ways because there's no consistency within that university or that college. So that person may think the kind thing to do is say, come on, you know, it'll be okay, pull yourself together, it's never so bad. That person may panic and think, oh, we've got to get them into medical help immediately and go into a pathway that gets them all tangled up with all sorts of things that aren't necessary. Actually, I think that if we had a consistent approach, if we had people trained in, people understood how to respond, it takes the fear and the sort of some of the difficulty out of this. It takes some of the heat out of it. Because if I know how to respond to that person sat in front of me, if I know what to say, that's going to keep me safe and that's going to keep them safe. So I think one of the biggest barriers I hear is I've spoken to many lecturers, teachers, professors, and some of them say, yes, great, I know what to do. I've been on a program, I have an idea. But the majority of them say, I have no idea what to do. I really don't know. So I think we need to get training, and it needs to be embedded within institutions so that it becomes part of the DNA. So it's not something that's an add-on that we think, oh my word, we have to. It's something that we do naturally, because 1 in 20 is quite a high number. The second thing that I see as an issue within the universities is this word duty of care. Universities and college, and obviously the duty of care in a college is slightly different to the duty of care in a university, but I just want to take the heat out of that a little bit, because most of us are trained in some kind of first aid, or we know a little bit about first aid. And if I'm working in a university or I'm a student and I'm in a car park and I have a heart attack, likely you'll run over and somebody will give me some help. I'm hoping somebody will know some basic have some basic training and be able to do CPR and keep me hopefully alive until the ambulance comes. When we get wobbly, when it's a mental health crisis, where's the difference? If I'm having a mental health crisis and I'm in the university, the college, or just generally in society, why is it different? Why are we not knowing how to approach that? What's the fear that we have in that? Because in my world, it's no different. It's absolutely no different. In fact, 1 in 20, it's more likely I will come across somebody having a mental health crisis, 1 in 20 thinking of suicide, than somebody having a heart attack. So we need to have some parity here between our physical first aid skills and our mental health, our suicide first aid skills, so that we are able to intervene. Of course, if I was intervening in somebody having a heart attack and my first aid skills might be a bit rusty, I'd be a bit scared, I'd be anxious, but I'd have a basic knowledge. And I think when we're talking about duty of care, we're talking about that moral duty of care as much as anything, that we have a large population within our college, our university. If we embed the tools that are available, if we embed those and truly start to embrace them, then actually most people may not go on to have those suicide thoughts develop into behaviours, and will keep people safe. So I think it's again about that collaboration, about looking at the tools that are available, and about being brave and taking some steps to embed them to the organisations that we work in.
Absolutely fabulous. And I like what you said there, which was you took the kind of sting out of the tail for a lot of people there, which was making them aware that thoughts are not actions. And by knowing how to respond to somebody having thoughts, it doesn't mean that they'll act on the thoughts. And there's a very good chance that they'll not act on the thoughts if somebody is there to talk to them and hear them. Why are they having these thoughts? Wonderful. Fiona, thank you. Anne, can I bring you in at this point as well? What's your thoughts here?
Yeah, so I'm not going to disagree with anything that Fiona said. And I think most definitely, yes, training is needed. I think, again, we're looking at a level of complexity here. We're looking at a volume of students that universities are dealing with that we need to also consider. So, I mean, I'll tell you about my morning. So prior to me coming on to this phone call or this webinar, I had a head of department. I'm responsible for over 1,000 students in my faculty at the moment, and 300 members of staff. I had a head of department who got on the call, or who called me just before this meeting, went live, to tell me that she had 2 students. One who was looking for an extenuating circumstances, an extension on a piece of work due to self-injury, and sent pictures of that self-injury to the member of staff as evidence that they needed the extension. And another student who had self-disclosed that they had experienced a rape in childhood that was coming up, and it was exhibiting in a piece of creative work that they had to do. Now, this is just 2 examples today. I get conversations like this with members of staff every day, and I have no doubt that I will probably have 1 or 2 more today. That member of staff who got in touch with me is responsible for 350 students on her program. So she's done the training. She has done the, mental health first aid. She's also done our in-house suicide prevention training that we have at Bournemouth University, and yet still did not feel equipped, was overwhelmed just by the sheer volume of other work that she also has to do. In addition, she was running to a class with some of those students. She runs a department, so she has responsibilities to the staff that she's managing. She also has responsibilities to the hundreds of other students under her care in her department who she may not have direct, meetings with every day, but it's quite complex when we start looking at the volume. And that's not an excuse. I am not putting it out there as an excuse. But what I am saying is that it's a very difficult situation for academics to manage on a day-to-day basis, not to mention, their own mental health challenges that come up, because of course we don't operate in vacuums. So academics come into this role, into their job, into their workplace with all of the baggage that they've got going on in their lives. So it's really quite a complex area. And and colleges are the same. I've spoken to colleagues who work at colleges all around the country, and they're experiencing the same thing. the fact of the matter is, you know, we're doing some great stuff at Bournemouth, which I hope we'll talk about a little bit later. But I think mental health services in this country are kind of broken. And I don't think anybody would disagree with that. And what's happening is universities and colleges and schools are picking up the slack for mental health services. And so there's a new burden on people who had studied for PhDs in a research area, who want to do research and then present that research to students in universities. And then they get into a university environment and you also need to provide pastoral support. And you also need to deal with students who have eating disorders. And you also need to support students who have gambling addiction. And you need to help students who have suicidal ideation and help students who have been sexually assaulted and experienced rape. And, you know, the social determinants of health, you know, trauma from childhood, this all comes to a head at these 18 to 21, 24-year-olds. And, you know, I'm not saying universities are doing it right. I'm not saying colleges are doing it right. But I am saying this is a very complex societal issue that we need to look at. And for me, I can never just blame, and I'm not saying that we're trying to do that today, but I am saying that we do need to look at this in a more holistic societal perspective, because where we're actually coming to this at universities is we're seeing this is kind of the tip of it. What we need to start figuring out is how do we prevent it from getting to this tip at university level? What can we be doing? What interventions can we be doing earlier on in the process? And then what support do we need to be having at universities and colleges to make sure that students are supported there and they're getting signposted to the people who can actually help them? But it's a bigger issue. It's a much bigger issue.
And a really important that you raised there, an important point that you raised there, it's not just about the students, is it? It's about the staff. It's about the people that are supporting the students, the teachers, lecturers. These people need support as well, and the skills to be able to support the students. Sam, can I bring you in at this point?
Yeah, of course. It was really interesting what Anne was saying there. My experience, both as an ex-police officer and working in a school environment, is that's absolutely the case. I mean, I found when I first went from policing into the school environment, the level of traumas that professionals were experiencing from effectively having to deal with other people's lives was high. I think there's a level of when we are doing any job, whether you're a cleaner, whether you're a teacher, whether you're a janitor, it doesn't matter. We have to have that expectation that if we are working with other people, this is what comes with humanity and this is what comes with people. However, there's the plus side is we can't be expected to deal with it if we don't have the resources or the people power to actually tackle it. And I think the issue is we are effectively going around in circles often. We are putting out mini fires for the next fire to get bigger. And we need to start looking forward to how we change culturally, probably as an entire nation, and actually start to get mental health. Understand that we all have mental health, not just people who are sick. Everyone has mental health, and how we are nurturing that. There's the phrase parity of esteem, where mental health is meant to be given the equal attention to physical health, but in so many ways it's not. And touching on my policing career, police officers were 5 times more likely to experience illnesses such as PTSD because of the high exposure to trauma. We're seeing this in education as well. We're seeing this, people experience this in colleges, universities, because they are microcosms of society, and actually experiencing other people's traumas very much can have an effect on you. I was at BET last week, and I met a lady who shared with me that she lost her sister to suicide. The sister was in her 50s. Her sister worked as a counsellor, and she'd been absorbing all this trauma. So we also need to say, look, we're not just you work for this organization, you must keep everyone well and alive, but also actually what you're doing for yourself too. Because I can tell you the front line are, your police, your ambulance services, that they're all knackered too, and they're all also suffering from these same issues that they are helping people with. So until we tackle that, we really won't ever see it get better, and we'll see it get worse. So I think really we need to look how we really implement that culture change and find clever resourceful provisions, whether that be online, whether that be training, whatever it looks like, and really talk about it, and actually see how is this working. Also, I think it's really important to be accountable for resources and provisions to show how they work, so people can really believe and trust them too.
Wonderful. Thank you, Sam. And quite right, as we're talking more about mental health now, and that could be young people, older people, are there people there to support them? Is there enough support? Is there enough people trained to be able to listen, to be able to support and guide somebody to the appropriate professional help? Is there the correct, appropriate professional help available? Wonderful, really good, thank you. And I'm going to come back to you with a question.
Sorry, Steve. Could I just make a point, if that's okay? Thank you. Yeah, it's been really interesting to listen to everybody and take 2 or 3 points away really from the conversation. I think it's really interesting, first of all, to take on board really what was said a moment ago by Anne around the societal issues. I think we understand that 50% of students coming to university have no prior history of mental health illness at all before they arrive at university. So there are quite often other issues that have created the issues that are being presented at the university at the time. So I think that's really important. And the Jordan Legacy, after several months of research, interviewing many dozens of people who've been impacted professionally or personally by suicide, published a report last July, moving towards a zero suicide society. And a very visual representation of that through the report is a puzzle with many pieces, and one piece missing there as well to say, what else are we missing? So there are many pieces to this puzzle that we need to be aware of, and it's not just about what happens at universities. I take also Fiona's point really about consistency. Universities operate very differently to schools. They operate, the 200 universities around the country, and really as individual businesses, and therefore manage their own approaches to mental health and suicide prevention. And many of them don't actually see student welfare as a priority for them as well. And I think that's really important to understand. I'm not saying they all don't, but they have their individual approaches to this. So I think there is a need for consistency across the board, across all universities. And just to pick up on the point that's been shared, I think, pretty well by everybody, including Sam there, we need adequate budgets and resources for universities to be able to know how to spot the signs, receive the training they need, make sure there is adequate training for lecturers, for head of faculties and departments, for teachers, for everybody who's involved, that everybody, because everybody can make a difference, and it shouldn't be left to one head of a faculty or something like that to be responsible for the well-being and mental health of students. So I'm just really, I suppose, emphasising the points that have been made here already. We need to look at all these pieces of the puzzle, really.
Thank you, Steve. And Steve, was that a resource that you can share with people?
Yes, in fact, that's the resource that we've made available today. It's a light read of just 84 pages, but a great executive summary up from which will give you a real feel for the conversations that we've had and the roadmap that's been created to help really move the suicide numbers on a downward trend towards zero.
I've just put the link in the chat.
Oh, thank you, Paul. There's my colleague, Paul.
Wonderful.
Don't go anywhere without him, by the way, just so you know. So.
Thank you, Paul. And I think there's a really good point that you made there, Steve. Each and every one of us can make a difference. And I think it's not just the sole responsibility of one person in a college or university. It takes everybody to come to work together. Thank you. And I'm going to come back to you with a question, because you mentioned about some of the current provisions in colleges, university settings. I'd like to learn a bit more about the work that you're doing in universities. What's working well? Where do you see gaps?
Yeah, so we take suicide prevention very seriously at Bournemouth University. It hasn't always been that way. but we have an amazing head of student wellbeing, Kerry Randall. Some of you may be familiar with Kerry's work. And we have a wonderful new Pro-Vice Chancellor for Student Experience, Dr. Shelley Thompson. And I like to think the three of us are a bit of a powerhouse, to be honest. The reason why I'm so interested in this particular topic, not just suicide prevention in general, is my partner died by suicide on a campus. He was a mature student and he took his own life on campus. So I'm very familiar with the challenges that come with that. And now being on the other side of it, being an academic, being a professor, being a senior leader in a university, I also then see, this side of it too. My work in Dorset, I sit on the Pan Dorset Suicide Prevention Strategy Group. And so, I look at real-time surveillance and our multiple work streams across the county. But what we did very early on was we set up a university strategy group. We have 3 universities in Dorset, and all 3 universities sit on that group. And we created links into NHS, public health, police, fire, ambulance, even the coroner. And other, mental health charities, Samaritans, Mind. We created a community volunteer group where anyone who was working in the voluntary sector, could join that group as well. Now, what came out of that was a couple of years ago, we actually created the first 3 university suicide prevention strategy in the country, where all 3 universities in Dorset signed up to a suicide prevention strategy, and then underneath the headings that they were working to, then took it and amended it and added more towards their own individual university and their student body. So they had some top level things that they were going to look at, neurodiversity, eating disorders, for instance, but then they applied that in their own university setting. Off the back of that, we were able to secure some funding. So we worked quite, in partnership. And in Dorset, we have the community front room model. Some of you may be familiar with this. It's community retreats where adults in the community can go. And if they need some support, they can, there's peer-to-peer support, but there's also clinicians on hand if support is needed. It's a place where people can go if they feel like they're at risk of hurting themselves, or if they just need a chat, or if they're in crisis. These are all across Dorset. We have several of them. So what we were able to do is we were able to secure some funding to open up a retreat for students. And we actually have this retreat sitting on the Bournemouth University campus. It's actually just outside my window here. And students from all 3 universities can attend the retreat. Now, we did some analysis and we identified that students on our campuses actually run into distress at about 2 p.m., which is really quite interesting. When are they seeking help? So it was from 2 p.m. and we found that the distress and when they were presenting to our local A&E departments in crisis was up until about 9:30 or 10 p.m. So we had a window there and we had data to inform us in our decision making in terms of when we were going to be opening up the retreat. So it's open from 2 until 9:30 p.m., Monday through Saturday, which meant then we had to make sure the university buses ran on a Saturday so that the students who were living in a different part of town could get to the campus. But we've done all of these things. We opened it in February 2023. It was a soft launch. And by September 2023, it was shut for the summer because we didn't have the funding to have it open last summer. So it ran from, say, January, February 2023 up until just after exams in May, and then it reopened again in September. And we were quite like, oh, this is interesting how many students are, availing themselves of this. But the September statistics were actually the most interesting. In the month of September alone, we had 1,000 students avail themselves of this retreat. 1,000 different students came to the retreat looking for a safe haven, looking for support. It has grown and continues to grow to the point that here we are in January 2024, and the heads of student well-being at all three universities are in a little bit of a panic mode because we've now outgrown the space where we can actually be supporting the students. So the students use the space as a place to decompress in between classes. If they have anxiety, they go there and they can do some breathing exercises. There's quiet rooms. The way that the interior design was used is, was based on principles of limiting sensory overload for our students who are neurodiverse. It goes on and on in terms of how we actually have created, this space. But this space is working. And it's something that has surprised us, I have to say. We thought we would get some traction with it, but it's gotten bigger than we thought. And that doesn't mean we've stopped offering other things as well. We still have face-to-face counseling. We still have a 24/7 hotline, and, where students can access, it's kind of, I guess it would be similar to like an employee assistance program for us, but, as adults working in, our professional workspaces. But it's a hotline specifically for students. But what's great about it is it has, last count, I think it's somewhere upwards of 150 different languages. So even our international students can call this hotline and they can be supported in their native tongue. So they're not actually having to communicate with someone in English, which we know from all the literature that if you have someone who looks like you opposite you and who is supporting you, your chances of actually recovering are significantly higher. So that's just one example that we're doing in Bournemouth, but it's one I would really like to see adopted across the sector.
And sounds absolutely phenomenal. I'm blown away by this piece of work. That is absolutely amazing. I see Fiona and Steve nodding away there. I'm sure that there's a question from you both or something more that you'd like to add. Fiona, let me bring you in at this point. Thoughts on that? And also, is there anything that you're aware of in colleges, universities?
So, yeah, absolutely fantastic, Anne, and it sounds like a brilliant piece of work, and it should be replicated across not just universities and colleges, but in society. It's something that's needed, as you've said, across your community. One of the things that I'd like to pick up on is around the culture change that's been spoken about, because I do think that that's important. I think, like we've said, one size doesn't fit all, and we need many approaches. And one of the things the University of Chester are doing, they've, back in 2022, decided to embed suicide first aid, suicide prevention training into their curriculum for their health and social care students. So they commissioned 8 tutors, and the programme was embedded in 2 ways. So the first year pre-registration students, midwives, social care students, have a light version of the programme. And then in 3rd year, before they complete their degree, they have the 1-day version. If we're going to talk about a culture change, it's very, very difficult to move from the top down. We need to really think about how we embed this in every part of life. And if we really want a culture change, you look at the work they're doing in Chester, it's been so successful that they're now commissioning further tutors to be able to deliver suicide first aid. Every single one of their health and social care students who go out into the world as professionals and as they develop their careers have a very good grounding in how to have that caring conversation that could help save a life. That's one way that, complements certainly the work that's being done, that Anne's described, and other pieces of work. But for me, it's about, how does the top meet the bottom, if you like? How do we come together and we do make these changes? Not just we're providing today for the people who need it, but also the people of the future. How do we keep our nurses, our social workers safe so that they've got the tools when they go into their careers? And how do we ensure that the culture changes so that they're thinking differently when they go into their workplaces and moving forwards?
Wonderful. Thank you, Fiona. And Fiona, you mentioned there was a difference in the light course and the 1-day course. So people that aren't aware, what's the light course?
So suicide first aid has a few different models, really. We've got Suicide First Aid Understanding Suicide Interventions, which is a one-day programme which teaches knowledge, skills and has practice. Suicide First Aid Light is an awareness programme. However, we also have developed Suicide First Aid for children and young people, so those working in schools. And we've developed Suicide First Aid for young adults, so those working in universities. We've got Suicide First Aid for essential services, which is the financial sector and our utility services, and for gambling operators, so working in the gambling sector. So we're approaching it from many different directions. And all our programs, they're all evidence-based. They've been independently evaluated. They're City and Guilds assured and accredited. So, you know, they do what they say on the tin. There's a lot of expertise goes in. And when we start working on a new piece of work, as last year we looked at heavy industries, which is a new one that we're just about to bring on board. We do a piece of work with experts in the field. So it's not just us saying we know this is good. We're actually bringing people in who know the subjects. And then we trial it. So the children and young people's version was trialed in Gwent in Wales. So we don't just say, here you go, here's a programme. It's actually been tested, it's been tried, and the experts within that field have given input. So it's a little bit about the work that we do.
Thank you for sharing, Fiona.
Can I just come in real quick on training, Steve?
Certainly,
just to say that, you know, training, we do need to train up staff in universities. There should be, I would argue that every member of a mental health well-being team at a university, or anyone who has direct contact with students with serious mental illness, or, you know, from serious mental illness all the way down to mild, we need to have people who are trained in assist on university campuses. That you know, we need that happening. And then we also need, like, almost like a, you know, there needs to be like a triangle of training. We've created a triangle of training in Dorset. So for instance, we've rolled out suicide first aid training across the county. I've just finished evaluating that. And what was interesting about, you know, colleagues across the county who worked in healthcare, education, you know, volunteer services, what came back from that was that it was great to have the training. They felt empowered when they were doing it. But the key findings from that research was actually that you need to continuously have training. And this goes back to what Steve was saying about resources. And actually, you know, we can't just train people up once. You know, we have to continuously keep that going. And that is a resource issue for many universities and colleges, you know, and sometimes it comes down to, well, we've got this student experience where, you know, we need to make sure that students are enjoying their time at university and college. They need to go on field trips and they need to do this. And, you know, and it's like, that's a quick win for National Student Survey results, the NSS. That's a quick win for the Office for Students. But actually, on the other side of it, it's like that money is then perhaps not going into training up people to be able to have that continuous training on mental health. So there's always, you know, a consequence to these decisions that are being made. And it does come back to the, you know, the regulatory framework that universities are now having to, you know, that they fall under through the Office for Students. You know, and yeah, so I just wanted to kind of throw that out there about training.
And could I just sort of come back? Could I just come back on that and say I totally agree with what you're saying, and I think that's where, you know, we need to have some steer here from the government, because they don't go far enough. You know, if we all have to do physical first aid in certain settings and it's mandatory, and you look at mental health and you look at suicide prevention, and there's nothing that says it's mandatory, despite the fact we know that we're going to come across more people having those thoughts of suicide than having a heart attack. So I do agree with you, and I think, you know, resource is limited, but that's where we need the steer from the politicians and the people who can say this needs to be mandatory.
And it's a problem when you don't even have, in the UK, workplaces do not have to track whether someone dies by suicide or not. So legally, there's no mandated for any workplace, you know. So if I died tomorrow, this university, as my employer, would not have to keep a record of that. So Sarah Waters, you know, Professor Sarah Waters, who does all that work around workforce, you know, suicide, she will also show that there's you know, there's a whole other layer to this as well when we start looking at it. So, you know, it's the tension between, you know, and we see this in NHS mental health services all the time. There's, you know, I did a project with a trust in the UK where it was ultimately, there were staff members dying by suicide. And when I said, can you show me your suicide prevention strategy policy, please? They handed me the one for patients. They didn't think about their own workforce. So actually, that's what we're, you know, at universities, you're looking at, there's a, you know, a support that's needed for students, but there's then the suicide prevention strategy that's also needed for staff, you know? So yeah.
Thank you to both of you. Absolutely, really, really valid points. I'm just aware of the time. We've got time for just one more very quick question. And Sam, I'd like to bring this question to you. What do you envisage for the future of mental health in education? In fact, before I get to that question, I've jumped ahead of the gun on this one. Let's go back to online for a moment. What strategies are implemented to mitigate these online threats?
Well, the online threat is a large threat that shouldn't be sort of overlooked, really. Technology's advanced massively over the years, and at a rate really we haven't kept up with safeguarding it. Just like when you get your 17-year-old wanting to learn to drive, we don't just stick them in a car and say, have fun. We make them aware of the dangers and we make that safe, and cars get better, whether that's better airbags or braking systems or whatever. That's what we expect. And we need to treat technology like that. We certainly should be embracing technology. For example, using it to advance education, using it to, in some ways, make the world a smaller place and make us all connected a little bit more and understand each other's cultures and beliefs and values. And, you know, that's all great. However, there's also a lot of harm, and we've also got to remember, with all good intent, there will always be people trying to take advantage of any way of harming someone. So, for example, groomers, people who want to harm children or in many ways harm adults. And there is a big issue online where individuals will find other individuals who are struggling and encourage them to take their own life, for example. So we just have to be aware of these things. You know, I worked in policing, I worked in children's safeguarding, and obviously very proudly worked for Ripple. So I'm very privy to information, quite upsetting information on a daily basis. But I think anyone in any walk of life can't be naive about what we have these days. If we are giving someone access to a computer, for example, are we doing that without any guidance? Are we doing that with an expectation that they're completely safe? That would be very ignorant. So what we do is we look at the possibilities and we of safeguarding. You know, obviously Ripple is just one amazing tool that can safeguard individuals and protect vulnerable people, but there is many other things on there. It has to work for that institution. Universities and colleges work quite differently into how they may safeguard. You know, for example, we can look at them primary schools, for example, they can safeguard in a very different way because they are much more able to block content altogether. But another thing we'll say about blocking content is the reminder that just because we're blocking it somewhere within your provision doesn't mean someone can't go out home and get it or find it somewhere else. And we also shouldn't underestimate the ability of our young students to find this information. You know, I work with autistic children who were on the dark web within a matter of minutes, something that went way over my head. I understand what it was, and they were on incredibly dangerous, harmful content. So I think it's about embracing that we have technology, but also being aware that, you know, we need to advance the safeguarding of technology at the speed we are advancing technology. Just like, you know, when we put anything into society, we make sure it's safe. We talked about the COVID jab. Was talked about a lot when it came in so fast, and we had to be convinced as a nation that it'd been through all this rigorous testing to make sure it's safe. The internet hasn't gone through that, and it's you know, it's not a small thing. The internet now it's a massive thing, and we've all got it in our pockets, and our children have it in their pockets, and we need to be very aware of that and very wise when we're introducing people to it.
Yeah, it's not about banning it altogether, is it? It's about safe use. How do we use it so it's safe? Steve, do you have any thoughts here?
Yeah, I'm very conscious of our time. We could have gone on for a couple of hours here, couldn't we?
For
I'm just
sure.
looking at some of the notes and thoughts I've got. Look, I'm just going to kind of wrap up with a thought here is that, you know, I've listened in this very short period of time to you know, the other panel guests here. There are clearly things out there that are working. And what we need to do is to collaborate. We need to get this information shared. We need consistency right across, in this case, the universities and education generally. We need to stop working in silos. It's as simple as that if we're going to make a difference and really get the suicide numbers down. It is about education as well. I think that's a really important point. I think the triangle mentioned a moment ago, but I'm very familiar with the triangle of care as well. We need mental health services, we need universities, and we need parents to all be speaking together. And we need to stop this ridiculous data protection situation where parents cannot be informed if a child is presented to the university with a concern, a mental health issue, because we know tragically we have lost too many students because of that lack of communication and resource. Much more I could go on with, Steve, but just very conscious of the time.
Thank you very much for wrapping that up, Steve. And I'm just going to go around to the other speakers as well. Sadly, we won't get time for the Q&A, but we will look through all of those questions and we'll get to all the speakers and we will respond to those questions. So if I may, I'd like to come to Fiona as we wrap today up, and I'd like you to just deliver your call to action, something for people to take away and can action.
I think if you take one thing away from this event, and there's many things that you can take away from it, it's don't leave your organisation with an empty toolkit through fear. Don't let fear prevent you going back and looking at policy, talking to HR, looking at student services, and work out what it is you need to do. And I think sometimes, as Anne said, it's complex. But actually, being complex, being scary, having stigma is not a reason to do nothing. I think you have to do something, and we all have to start somewhere. And anything that organisations do is going to make a positive difference in somebody's lives. So think about that 1 in 20 in your organisation, and think about what you can embed, the tools that are available. Training, the Ripple tool, which is a fantastic tool. And make sure that you don't hold back because you're fearful, because that's leaving vulnerable people without anywhere to go. And then they'll go to students who are probably just as vulnerable as them. And it all becomes, incredibly difficult to untangle. So it's really, don't let fear prevent you from taking action.
Wonderful message. Thank you, Fiona. Anne.
Yeah, thanks, Steve. I think we need media health, sorry, I'm in two different worlds. We need mental health and suicide prevention literacy starting in schools, very young age, and we need to not be afraid of that. And then what we also need to be doing is we need to be providing that same mental health and suicide prevention literacy all the way up to staff who work in any education setting. And we have to start breaking the fear around what it means when someone comes to you and says, I'm having suicidal thoughts. We need to break that fear and break the stigma.
Wonderful. Great message. Thank you very much, Anne. And Sam.
Just like we don't just brush our teeth once and then that's it, done for life. We need to continuously be working on mental health. It's not we've invested in something, that's it now, done. Everything's always going to change. Technology will change. We've got AI and stuff like that. Goodness me, what we'll have could be amazing, but also, again, very harmful potentially. So we need to make sure we're working together as well. We talk about the 200 odd universities and hundreds of colleges. We need to make sure that actually together we're working as colleagues. We may be based in different parts of the country and even different countries altogether, but if we can work together and share the common interest, actually, yes, the ministers might not make the right decision to mandate stuff and to get that consistent and to get that financial support. But as a group of passionate people about educating our youth, we can work together and actually force change in culture, because we represent such a huge proportion of people. Actually, if we're all on the same page and work together for this, we will naturally make culture change happen.
Wonderful. Thank you very much. Collaborative working. Absolutely. It's very clear there is a call to action on advocacy to invest in comprehensive mental health resources and training with educational settings emphasizing on the importance of addressing neurodiversity, language, inclusivity, and online safety. The goal to cultivate a supportive, inclusive, and safe environment for future generations. As we wrap up, I would just like to thank every single one of you here today for attending this session. We will ask you just to do a little bit of feedback at the end. And remember, we're going to give you some free resources as well. Each and every one of you can make a difference. I'd just like to say a very big thank you to all of the speakers here today, all of the attendees. Thank you very much for your time, dedication, and patience and contribution towards this discussion. Thank you.
Thank you.